Missing or delaying a meal is actually the single most common cause of severe low blood sugar. It relies almost exclusively on glucose. Even so, your brain is only about 2% of your total body weight. It consumes roughly 20% of all the glucose circulating in your bloodstream. When the brain runs out of glucose, its electrical activity begins to shut down, eventually leading to a coma. This is your fight or flight response. The body releases adrenaline to try and force the liver to release stored sugars. You will see profuse sweating and cold, clammy skin, trembling or shaking, neuroglycopenic symptoms. If the sugar isn't replaced, the vision, confusion, slurred speech, or erratic behavior, seizures leading directly into an unresponsive coma. If you find someone in a hypoglycemic coma, time is everything. Immediate, call 911 or if the person is unresponsive. Never attempt to pour juice, liquid, or food into an unconscious person's mouth. This will block their airway and cause aspiration into the lungs. Within 1 to 2 minutes, administrate 1 milligram of glucagon, subcutaneous or intramuscular. Glucagon signals the liver to dump its backup supply of glucose into the blood. Upon emergency arrival, paramedics or hospital staff will establish intravenous access and administrate a bolus of concentrated IV dextrose, followed by a cutaneous infusion of 10% dextrose to stabilize blood sugar levels. Finger stick plasma blood glucose test. The absolute gold standard first step to check exact blood sugar levels. While most people recover completely if treated quickly, prolonged or recurrent hypoglycemic comas can leave lasting damage, can manifest as memory deficit or cognitive decline. 2. Cardiac arrhythmias. The massive spike in adrenaline combined with low potassium during a crash can trigger dangerous heart arrhythmias. And finally, trauma. Physical injuries sustained from falls or accidents when the patient originally lost consciousness.